Hello. Good evening, fellow friends and loved ones. Yes, it's once again a very great honor and a deep privilege for welcoming myself into your homes this evening, the 21st of March 2021. Yes, it's a very great Sunday, and I'm sure we all had a very wonderful day. And today continues another important and interesting topic in the midst of our discussions, our health condition discussions. I'm sure that you enjoy today's topic, and then we'll have a lot to talk about in our next topic. Yes, and then also we'll have a lot to talk about to people about this specific topic. Yes, so without much ado, we begin this discussion in the name of the Father and of the Son and the Holy Spirit. Amen. Okay, so our outline is a quote, the topic itself. Then we'll talk about the definition of the condition, the origin, the types, the causes of this condition. There's something we call the Q angle. So we'll talk about the Q angle, how we diagnose this condition, the treatment, real statistics of this condition, the causes, the symptoms, and then how we can assess. So when we bring the person or the patient to the hospital, how we can be able to see that this person has this condition called the way we're going to talk about today. And then we talk about some researches that begin to relate to this condition. Yes, so without much ado, we begin this topic. So this topic for this evening's topic is titled knock knees, or scientifically it's termed as Genu Valgus. I know it's a big name, but we'll talk about it as time goes on. So this condition called Genu Valgus, or commonly called knock knees, is actually a condition that is very visible. When you have this condition, you can see it when the person is coming. You can see the person has their knees knocking. So anatomically, that is, the structures around the knee are very, very important, and when they get weak, they begin to present with so many conditions such as this called the knock knees. So when we talk about this condition, we zoom into our knees. So I'm sure every human being has a knee. As we grow, our legs become longer, and the knee helps us to bend, to sit down, and then also to be able to walk without falling. And so when we have weak knees, most people tend not to walk for long distance, and they have pains in their knees, and then they resort to hospital, they resort to using ointments around their knees. But as for this condition, it goes beyond that. So it's actually defined as a deviation of both knees, or one knee from one side to the other, mainly from the neutral point to the inside part. So if this is my knee, and this is my knee, shifts. These are my two knees. My knee shifts inside, and this one to shift inside, and they begin to hit each other. So that is what we call basically knock knees. Okay, so we have them coming together. That is called knock knees. So the knees are supposed to stand straight as this for you to be able to walk like this. But in the case where they begin to shift inside and another one shift inside, they begin to hit each other. And then scientists have described this condition as knock knees. So they shift to the midlines, they shift to the inside part of the knee, and then they begin to distort the normal alignment of the knee. So the person is walking this way, in like this, and then it slows movement. Actually, this condition is very, very serious. There are other conditions that bring this condition at an earlier stage, and we'll be talking about it very soon. So severe form of this condition causes persons or patients not to be able to walk at all. With little movement, the person gets tired and complains of pains in the knee, either one of the knees or both of the knees. And so we look at the origin for this condition. One, when we talk about this condition, Genu Valgus, there are two words, Genu and Valgus. Genu means, it's a scientific name. In science, when you say Genu, it means knee. When we say valgus, it means deviation or distortion or bending inwards. Okay, so we're talking about the word Genu valgus. Okay, so one very important research is that this condition is actually can occur from childhood. Yes, when the child is born. So you see that when you give birth to your newborn baby, you see that some of them have their legs shifted inwards, but then as time goes on, they tend to correct. It also can occur in older people as a result of so many conditions such as osteoarthritis. We have pain, just pain in the knee could cause these structures to compensate and then cause this condition called knock knees or Genu valgus to occur. So scientists have also said that it rarely occurs after 7 years of age. So when the child is born up until 7 years, there's a likelihood that the person could have knock knees, that's the knees coming together. But at 7 years, when it's not noticed, then there's a very less probability that such a child will have this condition. And also there's an angle of deviation, that is when the knees are coming together, there's an angle of knocking of the knee where when we measure we are supposed to expect an angle of about 12 degrees. So we have a device we call goniometer. So it's a device that we use to measure the angle at various joints. So when we measure and it's 12 degrees or more, then we can say that the person has knock knees or Genu valgus. So before we continue, some very important structures in the knee are, we have the patella, we have the femur, the thigh bone, we have the leg bone, that is the tibia and fibula. These are very important structures. And we have inside the knee, we have cartilages, we have ligaments, we have meniscus, we have tendons that helps to give structures to the knee. And so if we have the knee as this, the inside part of the knee, that's the one that faces the other knee, has an important structure we call the medial collateral ligament. Yes, medial collateral ligament. And we have the medial meniscus, we have various tendons around the knee. And these structures, when they become weak, they shift the knee inwards. So the knee has to compensate by adjusting the hip either outwards or inwards to prevent the knee from shifting more inwards. So these are very, very important points that we have to take note. So the inside part of the knee, we have a structure we call medial collateral ligament around the knee, and when it's weak, it shifts inwards, and this is likely to cause what we call knock knees. So the knees, as the person is walking, the person's knee hits each other. I'm sure we've seen some people walking with their legs hitting each other, and they're wondering why. So it's a condition that actually can be managed, and most of them feel pain when they are walking. So actually, science has classified this as a deformity. A deformity is something that goes beyond the normal. Okay, so we have so many types of this condition, but we will just dwell on two types of this condition. We have the primary pathologic condition, that is when other conditions bring this condition to place, and then we have the idiopathic Genu valgus. So they have the pathologic Genu valgus, that is when other conditions bring this condition into being, and we have idiopathic Genu valgus, that is when we don't really know what the cause of this condition is. So first of all, the idiopathic condition, as we said, we don't know, and it's mostly from birth. So when the child is born, because we have very weak structures in the knee, when the child is growing, there's likely that the mother wants the child to walk early, so we put the child to stand, and then child starts walking, and this is likely to weaken the structures in the knee as they are developing, and this could also shift the knee inwards, and this could bring about this condition called Genu valgus at an earlier stage. There are so many factors, such as it could be the child falling down on the knees, and this could also cause the Genu valgus. Yes. The second type that we call the pathologic genu valgus is actually as a result of so many conditions. We have osteoarthritis, we have fracture, we have even trauma. That is when you have a blow to your knee. That's the inner part of the knee. There could be weakness around the structures around the side, and this will cause genu valgus or knock knees. The other type of this condition, that is what we are discussing now, that is the pathologic. Actually, another cause is osteoarthritis. That is when we have depreciation or degeneration, that is reduction in a structure we call a cartilage in the knee. It causes compensation in the knee, either inwards or outwards, and these could also result in the knee shifting inwards and knocking each other, and this could cause knock knees. So some pictures will be shown after the presentation for us to understand very well this condition. Okay, so some of these causes actually they are congenital, that is from birth, and as we are discussing as a result of so many conditions, like osteoarthritis and trauma, and then it also be as a result of fracture of the knee joint. So we have specific cause of this condition. One, we have as a result of lack of some vitamins, such as vitamin A. We call that could lead to a condition we call rickets. Yes, rickets. So we have the bones coming together. I'm sure if you've not seen rickets before, just stay tuned and log into Facebook page RICOY, and then I'm sure we'll be able to get some pictures of rickets, and then we can see how it links to this condition called genu valgus or knock knee. There are so many conditions that cause us this condition called genu valgus. We have skeletal dysplasia, and we have the Mokio syndrome. We have the spondyloepiphyseal dysplasia, that is condition that affects the knee joints. We have condylotemal dysplasia. These are conditions that are scientific. Actually, I'm sure most of us might not be able to understand, but it's very, very related to this condition. And also, other causes of this condition could be as a result of tumor, that is cancer in the knee, and so this will cause compensation of the knee to push the knee inward, so the knees begin to knock each other. Also, we could have, as we mentioned earlier, fracture. There could also be infection. So if we have infection in the knee joint, we have a structure we call the bursa. That is, if you have bursitis, that's inflammation of the bursa, there could be infection in the knee joint, and this could result in compensation of the knee and pushing the knee hitting each other. These are all pathologic genu valgus, as we mentioned earlier, the second type of genu valgus. Okay, so we've mentioned and we discussed so many things, but how do we diagnose this condition called genu valgus? Yes, and it's a very, very important points of the discussion now. So the knee has two structures above and beneath it. So if this is a knee joint, above the knee joint is a thigh bone, and below the knee joint is also something we call our leg bone. That is two bones composing of leg bone. You have the tibia and the fibula. So the knee joint is actually a very important structure to be able to enable us walk. Yes, so as we said, there's a measurement that we call Q angle, and when this is more than a particular angle, that is more than about 22 degrees in females and then above 18 degrees in males, then this condition could be described as genu valgus or knock knees. So this angle is measured from somewhere we call the anterior superior iliac spine, and then from the anterior superior iliac spine, that is around our waist region, and goes right into our knee to a point we call the patella bone, the small bone in the patella, and then it goes right into a place we call just below our knee called a tibia tubercle. So when you measure this angle, from 3 points, from the anterior superior iliac spine to the patella to the tibial tubercle, we measure an angle called the Q angle. And when this angle is more than 22 degrees in females, then there's likelihood that the person could have knock knees. And if the angle is also above 18 degrees with the use of a device we call the gonometer, then this could also be termed knock knees in males. Okay, so it's very important that we take note about these angles. And then actually the presentation of the person, even in the walking, could see that the person has Genu valgus. This condition is not really viewed when the person sits down. When the person is sitting down, the knees are very normal. There's no stress on the knee. There's no pressure on the knee. But the minute the person stands, you see the knee shifting to one side or shifting of both knees into each other. So, other scientists have also said that a Q angle that is 12 degrees or more could be, in females, could be Genu valgus or knock knees. And then other scientists have also said that a Q angle above 17 degrees in females could be Genu valgus or knock knees. Okay, so we've seen what Q angle is, where the points of insertions are, but then let's take a little bit of statistics about this condition. So it states that this condition is mostly in children, and usually corrects itself as the children grow. As we mentioned in our earlier discussion, people notice it at an early stage. That's the child is noticed at an early stage, and then treatment begins as very early as possible, because at the point where the child is young, the bones are and the other structures can be able to get corrected early than when the child grows into a teenager or an adolescent. So in the ages of 3 to 5 years, that's when the child is walking, be able to observe this knock knees of the child as best as possible. Then as early as possible, treatment is given out or meted out, very possibly. So it's stated that by research carried out here that 75% of people with Genu valgus are between the ages of 3 to 5 years. And when they are noticed, that this 75% of people, about 99% of them recover fully. So to summarize it, when the ages of the children between 3 to 5 years are noticed early, they are treated as best as possible. 99% of them recover fully without any trace of the deviation or the shifting of the knee or knocking of the knee as it was noticed. Okay, so and it's shown that it's corrected at between 3 and 5 years when it's noted. By 7 to 8 years, it's corrected with exercises, with support to hold the knee in place. Everything becomes as normal as possible. And one very, very, very important factor that even if you don't learn anything from this discussion, we should take note is a severe lack of vitamin D and calcium. Vitamin D and calcium, these are very, very important components to build a structure in the knee very, very strong. And I'm sure that my fellow colleagues dietitians are also agreeing with me for this statement. Vitamin D is very important, and we get this from mostly sunlight. So outside in the States, in Europe, and in Asia, there's very, very, very less sunlight, and so statistics have shown that most of them have this condition called the knock knees. But in Africa, it's though an extensive research has not been conducted, it is shown that we don't see it as more as possible. But then it exists. So lack of vitamin D and calcium could predispose people to this condition called Genu valgus or knock knees. So let's take in a lot of calcium foods, and then our pregnant mothers too should eat a lot of calcium just to prevent our children from having this condition. And also obesity. Yes, so a child who is about 2 years old who is overweight and then also lacks vitamin D and calcium is liable to have this condition called knock knees as easily as possible because the weight on the knee becomes uncontrollable, and then this could result in someone having, or the child having, knock knees or Genu valgus. But this condition actually can be prevented. Yes, it can be prevented and minimized through so many activities such as physical exercises, and then lifestyle modifications such as our diet and what we eat. So how will you notice this condition when someone has Genu valgus or knock knees? How will you notice? This one thing is the person has weakness in the knee, so the person is able to control the knee as the person is walking. So the person walks with the knees knocking each other, so that when he takes one step, the knee knocks each other and then becomes unstable. There is instability during walking. That is when the person is walking, the person is not able to control himself, or and then when it affects one side of the knee and the other is not affected, the person attempts to limp, because then one knee becomes approximately shorter than the other, and then the person attempts or walks in a limping manner. Okay, so there's stress in these structures called the ligaments and the muscles and the tendons, and then this will cause pain in the knee. So as early as possible, we resort to using ice therapy or heat to minimize the pain, then we go into treatment. Okay, so first of all, when you visit the medical doctor or the physiotherapist with this condition called Genu valgus, what are you expecting that they ask you? Yes, actually they might not ask you too much because it's quite visible. So if you are walking, you could see the division, but the degree of severity will help to give the very, very urgent treatment as possible, so that we can prevent so many complications from occurring. There could be other complications such as it could be severe pain. It can be reduced into bed without even walking because of the severity of the pain. So when it's noticed early, we go to assessment. So we check the Q angle and check the degree of deviation. If it's more than 12 degrees in males, then we know. If it's about 6 degrees, then we know that we can do this treatment or give this treatment. If it's more than 17 degrees in females, then we can give it important treatment. So we ask questions such as your past history, have you fallen before, what the severity of pain, so that we can give you the best treatment as possible. Okay, so also in addition to these questions and this pain level that we ask you as physiotherapists or medical doctors, but we also request for an X-ray, an MRI, to see whether there have been ligament tears or there have been distraction of structures in your knee. In spite of the fact that there could be shift in the knee and there could be injury to the medial collateral ligament, as we mentioned, we have other structures we call the meniscus. So we consider so many factors, and then a condition we call osteoarthritis. I'm sure we talked about it in our previous presentations. Yes, I'm sure if you don't really remember, you can go on to my page and then scroll and look at our topics we discussed in the previous days, or you can go on YouTube and then just look on to RICOY and YouTube and our discussions, and then I'm sure you get to know about this condition called osteoarthritis. And so this condition called osteoarthritis could cause reduction in the cartilage in the bone, in between the two bones, so the leg bone and the thigh bone. So there could be reduction in the cartilage in between the two bones, and this could cause also the shifting of the knee inwards, and this could cause Genu valgus or knock knees. So the physiotherapist requests for an X-ray or an MRI to be able to see the extent of injury to the knee joint and its structures. Then as early as possible we start treatment. So very important treatment protocol is that one, we give you a knee support. Yes, when we notice that you have a Genu valgus or you have an early Genu valgus or knock knees, first of all we prescribe a knee support to prevent further worsening of the deviation, because this could be very serious and could could affect your work life or your social life, because then pain could keep you in the house without even going out. Okay, so we prescribe a knee support or a knee brace, and these help to prevent or reduce pain and also improve your activity of daily living. Okay, so aside the knee support, we also give um calcium supplements. Yes, calcium supplements, but there's not really an emphatic medication that we do. But then if we notice that we have very less calcium in your bones, we prescribe calcium supplements, and then we encourage vitamin D exposure, that is sunlight exposure, to enable your bone also to grow very, very strong. Okay, so some exercises that as physiotherapists we will go through with you is we have something we call the quadriceps bench exercise. So you put a weight on your ankle and then you raise your leg up and you sustain it for some time, and this helps to strengthen the knee. You could have squatting exercises that is above certain ranges, and this helps to strengthen the knee. We have stair climbing exercises, and these also help to strengthen the knee. We have weight exercises, we have balance exercises, we have so many exercises that as physiotherapists will go through to strengthen your knee. So when you have this condition, that is your knee knocking each other as you are walking, and it's important that you report as early as possible to prevent escalation of the pain. That's the pain becoming very, very worse. Okay, so I'm sure you've seen so many people working with their knees coming together. So this condition, actually, this presentation of the person can be treated and can be managed and as best as possible with the collaboration of the physiotherapists, the medical doctors, and the dietitians. Yes, and these help to allow the person to live a better and a more functional life. Okay, so aside physical therapy, when the deviation is more than about 70 degrees or 12 degrees, we could sort for we could seek for surgery. Yes, surgery comes into place, and these surgery are very important. After surgery, the person comes for physical therapy management to be able to restore function in the leg and then ensure normal alignment. I've treated patients who have this condition before, and I've seen very functional ability of the patients coming. Another surgical procedure we call the guided growth surgery, and this helps also to return the knee into its normal alignment. Okay, so a very important early treatment is the knee brace. So we have knee support to hold the knee in place, and we could have hot pack, that is heat therapy. We could have also taping to reduce we have kinesthetic, that's a plaster-like device, or yes, that helps to reduce the pain and also improve the structures around the knee. Okay, so a 2013 study stated that this condition mentioned earlier on, called osteoarthritis, also is a link, that is when the knee joint, that is the cartilage in the knee joint reduces. Yes, it causes the knee to, that's the two bones, the thigh bone and leg bone, to come together, and this could shift the knee inwards and cause Genu valgus or knock knees. So the study stated that most people who have this condition called osteoarthritis tend to have knock knees, that's the knee coming together, and this is mostly seen in adults, that is the elderly, where they have weak knee structures, and most females are predisposed to this condition called osteoarthritis, and then they are likely to have knock knees. Yes, so I'm sure we've had a fair idea of this condition. Yes, a fair idea of this condition, and it's actually manageable, very, very manageable. So we ensure that if you have this condition, you report to the physiotherapist or the medical doctor for further assessment and then early treatment to avoid other complications and to avoid surgery, because I don't think anyone wants surgery. So the first option is physiotherapy for this condition called knock knees or Genu Valgus. So some pictures will be shown very soon after the presentation on Facebook page. So you can log on to our Facebook page to see the pictures, and I'm sure you appreciate it the better. So the Facebook page is RICOY, RICH, and then KOTEY. So I'm sure you'll be able to get more information, and even see various discussions we had earlier on. You can scroll through my page, and I'm sure you'll get an extensive understanding of this condition with the pictures. Okay, so I'm sure we've learned a lot, and many people came through. I'm sure we've learned a lot. So today's topic was Genu Valgus or knock knees, and I'm sure we've learned a lot. So without much ado, if you have any questions, we can forward it on our page and for us to ask and answer. And I can see Marcos, I can see Joan, I can see Zafar. Thank you for watching. Thank you for, and those who came through. Yes. If you have any question, you can ask. Before we mention our next topic for next week, the last Sunday of the month of March. Okay. So I believe we've learned a lot, and even though there are no pictures, we'll be seeing pictures very soon on our Facebook page, RICOY, RICH, and then KOTEY. So stay tuned, and you can also log into our YouTube page, and then there are so many discussions that we've pasted on. And so thank you very much. So our next topic for discussion is titled, it's a very big name, so just take your time, and then let's share the page, let's share the flyers, let's share the links to our various contacts so that we can all get to learn at our discussion or during our discussion next week. So our discussion next week is titled Guillain-Barré syndrome. Guillain-Barré syndrome, GBS. It's called GBS. So the acronym is GBS, Guillain-Barré syndrome. So let's stay tuned for next week's discussion. So this evening discussion was Genu Valgus or knock knees. Thank you very much for your time. May the good Lord be with us all. Have a blessed week as we end the third week in March. Take care. See you. Bye.